Hey everyone, my name is Dr. Matthew Perry, owner and operator of Auto-Ness Therapies and lead physical therapist as well. I hopped on here because I wanted to share with everyone my why. I wanted to explain why I became a physical therapist and why really I'm doing what I'm doing. So it started back in about 2013. I was a collegiate athlete. I had played hockey leading up to about 2012, 2013. That's ice hockey. And then I played rugby for a couple years at my school. And while I was playing rugby, I started having a lot of pain going down my legs. And it would kind of alternate from side to side. And I didn't really understand what was happening. It kind of felt like my leg was a little like tight or numb. And so I would just stretch and do all of that, and nothing really made it better. So I finally went to the doctor and I got an MRI, which is, a picture of my back and my back and also my hips. And the doctor came into the room after the MRI and said, Matthew, I don't really know how to tell you this, but I saw two herniated discs in your low back. At the time, I had just gotten into the fitness realm, so I didn't really understand what that meant, but I had heard that before: herniated discs or bulge discs in my back. That was very devastating to me. I asked the doctor, "Well, what do I do?" And he said, "Well, if you like your back and want to be able to use your back going into the later years of your life, you're going to do absolutely nothing again. Not lift weights, not play sports, any of that." So I'm sure you can imagine, as a 23-year-old getting diagnosed with something like that, it was very, very traumatizing for me. I was very distraught. I felt stuck and helpless. Through all of that, my pain got worse. After that diagnosis, my symptoms overall increased, and I was very fearful. What happened out of that is actually a very, very good story, and this has a really good ending. Um, what I tried to do, and one of my main motivators of trying to get myself healthy, was actually to enroll in PT school, physical therapy school, and become a physical therapist. Because I knew there was some way out of this. I just didn't quite know what that looked like, getting myself healthy, getting myself pain free. So I enrolled in the PT school. I went through the curriculum. I spent every class trying to take in all of the information and learning how to treat myself. I would apply it to myself and my back issues before I completed the assignments or the examinations or practicals, all of that stuff. So I actually got pretty good at treating myself. I spent most of PT school being relatively pain free. I realized, and it was very eye opening, that when I had more back pain, it was the times of high stress, times of prolonged sitting, and general inactivity. So when I sat too much, when I wasn't active, and when I was very stressed out, it was those three times when my back pain got worse. I found a pattern. That was great. And since graduating from physical therapy school and being in my practice, I've continued to work on treating myself. And I think that my experience with my own chronic back pain, for anyone else who's had it, it can be very, very debilitating. So I think it gives me a unique understanding of how to work with people who've had chronic issues, chronic shoulder pain, chronic back pain, chronic knee pain. They're all very similar in that you don't know what to do. You feel stuck. You might have had medical doctors in the past, not speaking ill of anybody, but them saying that you can't do anything else for the rest of your life. That's simply not true, because I can tell you today, I am able to lift tons of weight. I can lift 225 pounds overhead in an overhead movement. I can run, I can jump, I can do everything I can completely pain free, which has been very liberating. And why I started this company was to show everybody some of the things that I've done in order to make myself move pain free, in order to empower myself, right? And every person is different, and that's why I encourage sessions and one-on-one times with myself or another therapist, in order to make sure that we are addressing you as specifically as possible. But again, you don't have to be stuck. That's what I really want to get across, because I was, and I know how that felt, and that made my issues worse. So I do want to let you know that I'm here for you. If you ever need to hop on a call or would like to hop on a call, I'm here in order to help you move pain free, and again, to help teach myself out of a profession. I want to empower you with the tools, so then you don't have to come see me or anybody else. You can come if you like. That's fine. I'd love to see all your smiling faces. However, there are plenty of people I can help in this world. And, I do want to work with people one-on-one, one by one, in order to train myself out of a profession. Thank you very much for listening, guys, and take care. Have a great day.